The most important question is whether this is hanging or not. First, we have to decide it is hanging or not, and if it is hanging, then it is suicidal, homicidal, or accidental. To decide whether it is hanging or not, because it is common usually to kill someone and hang him, that is the post-mortem hanging, and we should make a clear distinct between the finding whether it is ante-mortem or post-mortem hanging. The ligature mark usually is to be discussed most important, and for decision that hanging is ante-mortem, we have to rely upon certain characters. Ligature mark will be showing abrasion, redness around its substance. That is, what is ligature mark? Ligature mark is an imprint abrasion in hanging and strangulation because of the compression, because of the rubbing. It is an imprint abrasion and it furrows deeply. Initially, it is pale, but later on, it becomes leathery, parchment like, hard, brown, and black sometimes. And around the ligature mark, there will be abrasion and redness. Then the diagnostic feature we discussed on the external finding is the dribbling of saliva. So ligature mark having abrasion and congestion, dribbling of saliva from the mouth, and rupture of the intima of carotid arteries, and deeply congested lymph nodes above and below the ligature mark. So these four are distinct features which differentiate between ante-mortem and post-mortem hanging. Then fracture dislocation is usually in judicial hanging, and absence of any other fatal injury. That means there is no mark of resistance, no other mark. It means that it is hanging. Then we should particularly visit the scene of crime, and in the scene of crime, the findings which are noted, the posture or the position of the body in which it is lying, then the disarray or rearrangements of the other things like the uh, furniture, the clothes. So all these things should be studied, and the length of drop should be seen, that from which height the string was tied and what was the drop, and that is looked into, and with that we can decide about the occurrence, that is homicidal, suicidal, or accidental. About the accidental, it can happen, rare, but it can happen usually at work and sometime in sexual deviation, which is the uh, traumatic asphyxia basically. Then sometime in road traffic accident, the neck can be hung or head can be hung in the steering wheel, falling from ladder. So these are all accidental. In homicidal, it is not possible. It is rare that if you try to hang someone, it is difficult with one person. So it can only be possible if there are more than one individual, or the person is debilitated, weak, under the influence of some drug, then you can overpower and hang him. So it is difficult with the single assailant. So homicidal can, and it is suspected when knot is at the back, mouth is gagged, something stuffed into the mouth, the limbs are tied, and other injuries are also found there. They are showing the mark of resistance. So these findings are in the favor of homicidal hanging. Then if you detect the on chemical examination some stupefying drug, that also is favor of. Sometimes the individual himself suicidal, while doing the suicidal hanging, he himself can take, but usually it is in the favor of homicidal. And it is also seen in cases of judicial hanging, but that is called as justifiable homicide, because that is the execution of some crime. So judicial hanging is also a homicidal hanging, but that is justifiable. Lynching is non-justifiable. Lynching is when the mob or the person more than one, they overpower and they strangulate or then hang the person. That is called lynching. In suicidal hanging, the points which favor, that usually it is seen that the males prefer to commit suicide by hanging and the females by drowning. The suicidal person, a person committing the suicide, usually find a quiet place. There may be uh, readily available material, anything which is available. That may be the chadar, that may be the dhoti, sari, shirt, or anything which is readily available, that is used. And he ties the one end to the higher point, like the beam or the fan hook or any other uh, point, the branch of the tree if it is an open field. Then he usually stands on a stool or anything from which he or she can jump. If it is from the tree, he can climb up the tree and jump from there. And this will cause, when someone jumps from stool, someone jumps from the tree, this will cause complete hanging. Complete hanging is when the feet does not touch the ground. Then the points which also are in favor of the suicidal hanging, that the body should be compatible with suspension, self suspension, and complete suspension is usually in the suicidal hanging, because they prefer to jump from a higher place. But unusual positions, as we have discussed, that kneeling, reclining, they can cause the compression of the neck. And sometimes the victim ties in his own hands and feet himself. Then the position of the ligature and the knot, it should be compatible with the scene, with the suicide. There will be no signs of struggle. Sometimes suicidal note can be found. And when you do the psychological autopsy, that means the investigation to visit the friends and the family, ask about the history of the individual, you may find the element of some psychological illness, depression, or other psychiatric diseases. Then it is said that blindness, the person is blind, he cannot commit suicide. But blindness and age, any age, can be prone to suicidal attempt. So blindness and age is not important. It is no bar for the suicide. And sometimes other suicidal injuries like cutting the wrist, cutting of the other structures can be seen before uh, attempting the suicidal hanging.